So hello and welcome to my YouTube channel. My name is Ongoing Mwangi, your Kenyan nurse here, coming back with an oncology nursing related video. So today I'll be talking about safety regarding chemotherapy post administration, and this is care at home. So these are precautions for the family and the patient once they get home. So following administration of chemotherapeutic drugs in the hospital, or if you are doing them at home, it is important to remember that they will remain in your system for up to 7 days, but most likely for the next 48 hours after administration, there will be active shedding of chemotherapeutic agents in your bodily fluids. Therefore, there are precautions you could take to prevent exposure to any other person in the family and household, and especially the minors and the elderly, anybody above 60 years and anybody below 5 years. 5 and under. So it is important to follow different precautions for different settings. If you're doing your chemotherapy at home, meaning you have either oral medications or you have a set infusion that came with you home. If you came with an infusion home, let's say the 26 hours or 46-hour infusion, then you should have a specified room that you can stay in. Other members of the family should avoid getting into this room. So while you are on treatment, it is important to have a room to yourself and a toilet you could use by yourself without sharing it with the rest of the family. So if you are doing this infusion, it is also good to check up with your home visit nurse or care nurse who is helping you get your chemo at home, so as to minimize risks of exposure to other persons within the household. So if you're not the one getting the medication, let's say it's now oral medications, if you're doing the oral medications that are chemotherapy at home, then it is important to remember to handle those pills by yourself. If you're the patient, make sure if the pills will come in a blister pack, take it out of the blister pack by yourself. Don't have someone pop it out for you, because you might be exposing them. It is important to remember not to crush the pills, not to open capsules, not to handle those capsules excessively. You only need to keep swallowing as prescribed and as during the time that you are just supposed to be swallowing them. So take them by yourself, swallow them by yourself. Do not expose other people to these pills because they are also chemotherapeutic agents. So now that we're done about handling the chemo itself, let's talk about side effects. Some of the patients getting chemotherapy will have nausea and vomiting, and this will need to be contained somehow, meaning you have to vomit into something. There should be a vomitor's bowl or a bucket for this purpose, and it should only be for this purpose alone, and should be discarded once you complete your chemotherapy sessions. So if you vomit in the bucket, then it can be emptied in the bowl of the toilet, and then cover the lid and double flush the toilet. Then clean the bowl properly and have it by your side. Use that same bucket or bowl at all times. If possible, use something that has a lid so that you can cover it. Option number 2 is cleaning up the spill or managing a spill. So you should have a spill kit, something that can contain your spill of either bodily fluids or the chemo itself if it gets spilled. For example, let's say you're on an IV infusion that you took home. If it spills on the nearby surrounding, it is important for you first to get something to contain it, and that is what I'm talking about, a spill kit. A spill kit basically has 3 components: something to absorb, something to neutralize, something to dry out. So something to absorb, it could be a sponge, it could be a towel, it could be something that can absorb that extra liquid. Once it's absorbed, you should discard it in a waste bag, garbage bag basically, and then you seal the bag. Anything that is exposed to the chemo, you should put in a bag and seal the bag, so to ensure that it is not emitting anything else into the air or the surroundings. So yes, manage those spills prudently. Once you have absorbed all the chemo that had spilled into a spill sponge, then discarding the sponge in a garbage bag that is sealed. Then you should clean either with something that has chlorine, maybe jik, 1 in 3 parts, if not, or 1 into 5 parts. If not, you can use warm soapy water. If you have spirit, you can also clean with it. But basically something to disinfect your area with, to ensure that that chemo spill has been taken away. Number 3 involves about doing your business in the washroom, and this is going to the toilet, whether you're going for number 1 or number 2. If you're doing number 1 and you are male, you'll have to sit down on the bowl so that you do not overexpose the area until you are doing your number 1 on, so you do not splash the pee a lot. So you sit on the bowl and pee, or do number 1. Then cover the bowl and flush twice, especially if that toilet will be shared with other people in the household. If you're doing number 2, of course you will be seated. So once you're done, make sure you close the lid and again you double flush. If there is a possibility for you to get your own washroom or one toilet that you can use specifically for just you, that should be the case for the next 7 days following chemo administration, since I said the chemo drugs will still be in your system for up to 7 days. So yes, depending on which drug. So, and this goes without saying, even the bed where you're sleeping, the bedding, it is prudent if you spend alone. If you have to share them with someone, I don't know, it is not the ideal. It is good to protect the person who should be sleeping next to you. So for the 7 days after chemo administration, you can just sleep on your own bed, and those beddings again will be washed separately from the normal laundry that you do in the household. So the other chemo safety precaution at home involves about having sex, especially if you really have to and you have just had your chemo. It is important to use protection, especially if you're still ongoing with other cycles of chemotherapy and you have just had this chemotherapy session. Then you need to use condoms basically, and this is an extra measure of safety to ensure you're not passing anything to the next person, as I said, and that assuming you're getting chemo, the last precaution I'll talk about, if one is taking chemo and they're either expecting or they have a small child, it is important to remember that you're not going to breastfeed that child as long as you'll be on chemo. This is to avoid passing the chemo from you to the baby, because probably the baby does not require that chemo. So yes, before you even commence your chemo treatment, it is important to inform your doctor in case you are pregnant or you are breastfeeding or you're in any of these transitional roles. If you're pregnant, the first trimester is a no-no to chemo, so you find most doctors will rarely give chemo in the first trimester, because that is when the baby parts are forming, and meaning there could be teratogenicity or deformations or deformities caused by chemo if you get the chemo while expecting. It is important to check before you start any treatment whether you are expecting. Even if it is those very first few days of pregnancy when you are not aware, it is important to do a pregnancy test before you start some of these treatments. So if you're breastfeeding and then your cancer is discovered, it is important to discuss with your doctor so that you make plans for alternative feeding, because once you begin chemotherapy, your child will go to alternative feeding methods since they will not be breastfeeding. So the last precautions is on handling the treatment itself and ensuring that it is locked up in a safety cupboard away from reach of children and people who are not of sound mind. It is very hard to get antidotes for some of these chemotherapeutic agents, and it could be fatal if some children take this. Remember, chemotherapy, another term of chemotherapy is cytotoxic drugs, meaning toxic should tell you it is toxic. It is not to be taken if you are not prescribed for. So if you take a drug that you haven't been prescribed for, here in Kenya we say you have just taken some small poison. So you do not want any of your children or any minors being exposed to drugs they have no business with swallowing. So lock those drugs away only for your access, or an adult with supervision, or if someone else has to handle them for you, they should be in a specific corner that not everybody can access, especially those who have no idea what. So thank you for watching my video. I'll come back with another video regarding chemotherapy side effects and what you can do to make them feel better. So stay tuned. Please subscribe to my channel, like, comment, and I'll get right back to you. I react to every comment and I like almost all the likes that I get. So keep on supporting this channel and we'll keep growing with more informative videos such as this.